the silent killer, why you need to understand it to protect yourself and your family. High blood pressure, often called the silent killer, is one of the most dangerous health conditions in America today and one of the most overlooked. Why? Because it rarely causes symptoms until it's too late. You might feel perfectly fine while this condition is silently damaging your heart, brain, kidneys, and eyes. Here's the reality. Nearly half of U.S. adults, about 120 million people, have high blood pressure. Even worse, many don't know it. And among those who do, most fail to manage it properly. That's why doctors call it silent. It works quietly, without warning, increasing your risk of heart attack, stroke, and even death. Think about this: every 40 seconds, someone in America has a stroke. Every 34 seconds, someone has a heart attack. High blood pressure plays a major role in those statistics. And the scariest part? It often gives you no warning signs, no pain, no obvious symptoms, just damage happening in the background. So, what is high blood pressure? Simply put, it's when the force of blood against your artery walls is consistently too high. Over time, this extra pressure wears out your arteries, making them stiff and more likely to clog or rupture. It's like a water hose. Under too much pressure, eventually, it fails. Many people ignore blood pressure because they feel fine. But feeling fine doesn't mean you're healthy. You could have dangerously high numbers and never know it until a sudden stroke or heart attack changes everything. Here's a real scenario. John, 52, a hard-working truck driver, skips regular checkups because he feels healthy. One day, he suffers a massive heart attack on the road. Doctors later discover his blood pressure had been dangerously high for years. That attack could have been prevented. This isn't rare, it happens every day. And it's not just older adults. More young Americans in their 32nd and 42nd are developing high blood pressure due to poor diets, stress, and lack of exercise. Managing blood pressure isn't just about taking medication, it's about taking it correctly and avoiding dangerous mistakes. In the next sections, we'll reveal the 4 most common mistakes people make with their blood pressure meds and how you can avoid them to protect yourself and your family. The first mistake people make with blood pressure medication. When it comes to managing high blood pressure, medication can save your life, but only if you take it correctly. And here's the truth. The biggest mistake people make is stopping their medication too soon. Many people feel fine after a few weeks or months of treatment and think, "Great, my blood pressure is normal now. I don't need these pills anymore." That decision could be deadly. High blood pressure isn't like an infection that disappears after a few days of antibiotics. It's a chronic condition, meaning it doesn't go away on its own. Your blood pressure is only controlled because of the medication, not because the disease is gone. When you stop taking your meds without your doctor's approval, your blood pressure can skyrocket in a matter of days. This sudden spike, called rebound hypertension, is extremely dangerous. It can trigger a heart attack, a stroke, or even sudden death. And the scariest part? It often happens without warning. One day you feel fine. The next day you're in the ER, or worse. Here's an example. Sarah, 48, decided to stop her blood pressure pills because she wanted to get healthy naturally. For 2 weeks, she felt okay. Then, one morning, she collapsed with a severe stroke that left her partially paralyzed. Her doctor said if she had stayed on her medication, the stroke likely never would have happened. So why do people stop? Some worry about side effects. Others don't like the idea of taking medicine forever. And many believe once their numbers look good, they're cured. But here's the reality. Your numbers look good because of the medication. Stop the pills, and the numbers shoot back up fast. If you're worried about side effects, don't quit on your own. Talk to your doctor. There are many medication options, and most side effects can be managed, but stopping suddenly is never the answer. The bottom line: never stop your blood pressure medication without medical advice, even if you feel fine. Feeling fine doesn't mean you're safe. It just means the medicine is doing its job. In the next section, we'll uncover the second big mistake that can make your medication useless and put your life at risk. The second big mistake: skipping doses or taking them at the wrong time. If you think missing a pill here and there isn't a big deal, think again. One of the most common and most dangerous mistakes people make with blood pressure medication is skipping doses or not taking it at the same time every day. Blood pressure control is all about consistency. Your medication works best when there's a steady level in your system. Missing a dose or taking your pills at random times can cause your blood pressure to swing up and down, creating what doctors call fluctuations, and those fluctuations can be deadly. Here's why. When your blood pressure jumps too high, even for a short period, it puts enormous strain on your heart and blood vessels. That sudden spike can trigger a heart attack or stroke. And the scary part? Sometimes you won't feel a thing until it's too late. Consider this. Michael, a 5-year-old office worker, often forgot his morning pill because he was in a rush to get to work. He thought missing once in a while was harmless. Then one stressful day, after skipping his dose, his blood pressure shot up to dangerous levels. He ended up in the hospital with a severe stroke. Why does this happen? Because blood pressure medication doesn't work like painkillers that bring instant relief. They work by keeping your pressure stable over time. When you skip a dose, that stability disappears and your arteries take the hit. The same danger exists if you change the time you take your meds every day. Taking it in the morning one day and at night the next can throw off the balance your body needs. Consistency is key. That's why doctors recommend picking a specific time every day, like right after brushing your teeth in the morning and sticking to it. Here's a quick tip. If you often forget, set a daily reminder on your phone or use a pill organizer. These small habits can literally save your life. The bottom line: don't skip, don't delay, don't guess. Your medication only works if you take it exactly as prescribed. In the next section, we'll talk about the third mistake, one that has nothing to do with forgetting pills, but everything to do with something you might be doing at your dinner table every night. The third mistake: eating and drinking habits that undo all your progress. You take your blood pressure medication every day. You never skip a dose, but your numbers are still high. Why? The problem might be sitting right on your dinner table. One of the most overlooked mistakes people make is ignoring diet, especially salt and alcohol. These two can silently destroy all the benefits of your medication. Let's start with salt. Most people know too much salt is bad for blood pressure, but they don't realize how much they're really eating. It's not just about the salt shaker. It's in processed foods, canned soups, sauces, frozen meals, even bread. Every extra pinch adds up. And here's the kicker: too much salt makes your medication less effective. When you consume excess sodium, your body retains water, which increases blood volume. More volume means more pressure inside your arteries, forcing your heart to work harder. So even if you're taking medication, your numbers stay stubbornly high, or worse, start climbing. Now let's talk about alcohol. Many people think, a little drink can't hurt, right? Wrong. Alcohol can raise your blood pressure, interfere with how your medication works, and even increase side effects like dizziness or fatigue. Plus, drinking regularly, even just a couple of glasses of wine each night, can undo weeks of progress. Here's a real example. David, 60, was on 2 different blood pressure medications. He never missed a dose, but his blood pressure wouldn't budge. Why? Every evening, he enjoyed just a couple of beers. When he cut back on alcohol and reduced salt in his diet, his numbers finally dropped and stayed there. If you're serious about protecting your heart, here's what you need to do. Read food labels and watch out for hidden sodium. Choose fresh whole foods whenever possible. Limit processed snacks, fast food, and frozen meals. If you drink, do so in moderation, or better yet, skip it entirely. Remember, medication isn't magic. It works best when paired with healthy habits. Don't let a salty meal or a few drinks undo all your efforts. In the next section, we'll uncover the fourth mistake, one that often hides in plain sight, and it has everything to do with mixing medications without realizing the danger.
The fourth mistake of mixing medications without checking first. You've probably seen those commercials. Take this supplement for a healthier heart, or try this natural remedy for better blood pressure. They sound harmless, right? But here's the truth: mixing medications, even with natural products, can be one of the most dangerous mistakes you ever make. Many people think if a product is over the counter or labeled herbal, it's safe. Unfortunately, that's not always true. Certain supplements can interact with your blood pressure medication, either making it too strong or completely ineffective. And sometimes, the result can be deadly. Take this example. John started taking an herbal tea that promised to cleanse the body and improve circulation. What he didn't know was that the tea contained ingredients that lowered blood pressure. Combined with his medication, his blood pressure dropped too low, he fainted at work and ended up in the ER. The same risk applies to other common products like painkillers, decongestants, and even antacids. Many over-the-counter cold medicines contain ingredients that raise blood pressure. So if you're popping them without checking, you could be undoing everything your prescription is trying to achieve. And then there's alcohol. We talked about it in the last section, but did you know mixing alcohol with some blood pressure meds can intensify side effects like dizziness, fainting, and even irregular heartbeat? Here's what you need to remember: never assume safe means safe for you. What works for your neighbor, or what you read online, could be a disaster when combined with your prescription. So, what should you do? Before taking any new supplement, over-the-counter medicine, or herbal remedy, ask your doctor or pharmacist first. Keep an updated list of everything you take: prescriptions, supplements, even vitamins, and share it with your healthcare provider. If you notice unusual symptoms after starting something new, stop immediately and call your doctor. Your medication is carefully chosen to control your blood pressure without harming your body. But when you start adding things on your own, you turn a controlled system into chaos. Don't take that risk. In the next and final section, we'll wrap up with the most important advice you need to live longer, stay healthy, and keep the silent killer under control. You have reached the final part, and this is the most important one. Now you know what high blood pressure can do if you ignore it. It is quiet, it is patient, and it never gives a warning sign. That is why doctors call it the silent killer. But the truth is, you can control it, and you can live well. You just need to follow a few clear steps every single day. Start with your medication, because that is the first line of defense. Take it as your doctor told you, not as you think is right. Do not skip doses. Do not double up when you forget. Set a daily reminder on your phone, or keep a simple note. Put your pills in a small box for each day of the week. This one habit can keep your pressure steady and safe. The second step is food, because what you eat matters more than you think. Cut down on salt, because salt pulls water into your blood. More water means more pressure, and more pressure means danger. Avoid junk food, processed snacks, and fast food meals. Eat fresh vegetables, fruits, and lean protein like chicken and fish. Drink clean water, and stay away from too much soda or alcohol. 1 or 2 drinks can still be harmful if you have this condition. The third step is movement, because your body needs it every day. You do not need a gym or heavy weights to stay fit. Just take a walk for 30 minutes around your block. Climb stairs instead of using the elevator. Stretch your arms and legs while watching your favorite show. Small actions add up, and your heart will thank you later. The fourth step is rest, because stress and lack of sleep make it worse. Try to sleep for at least 7 hours each night. If your mind feels heavy, practice deep breathing or listen to soft music. Find a calm activity like reading or gardening to clear your thoughts. Stress is an invisible enemy that pushes your pressure higher. Keep it away by taking care of your mind as much as your body. Do not forget to monitor your numbers, because knowing is power. Check your blood pressure at home, and write it down in a notebook. Bring that record to your doctor, and ask questions without fear. Never try a new pill, herb, or drink without checking first. What works for one person can be dangerous for another. Your doctor is your partner, not just a person who gives medicine. Finally, share what you have learned with your family and friends. Someone you love may be walking with this silent danger and not know it. You can be the reason they live longer, stronger, and happier. High blood pressure is real, but it does not control your life. You have the power, the knowledge, and the tools to win this fight. Start today, stay consistent, and never give up on your health.